right. Hey, y'all. We are back. Welcome, welcome, welcome. So, we are back with another episode of our birth stories. And we are back. Oh, y'all, I got the echo on. Hold on. Welcome. That's a shame. I still don't know how to do this thing. Of our Okay, I got it. What's going on, y'all? So we are back for another episode of our birth stories. Y'all, this is episode 9. Like, I can't believe we made it all the way to episode 9. This started off as I'm not going to say random because it was not random. Like, it was something I had been wanting to do for many years, but just never got into it, right? And so last month I decided, like, just do it, like, just go for it, right? And I put the status up on Facebook asking, would anybody like to share their birth stories? And I got like a real, like, overwhelming amount of people saying that they would, which is a good thing, right? And so I was like, okay, just do it, right? Like, what is the harm? But I definitely know that this is necessary. It's a needed conversation in our community. And so I'm just glad that, we able to really just have this platform to be able to share. And then what turned into like the personal birth stories went into the professional aspect. So we have a little bit of both. So I'm happy about that because now it can go more from awareness to education or just like include a little bit of both. So I'm happy about that, y'all. It's just kind of it's just crazy like how the most high will align things when they're supposed to be. So that's just where I'm at with it. But we on episode 9. I have these grand ideas to be able to finish, I guess, what we would call season 1 with episode 10. So at the 10th episode, I'll probably take a little break to see how we can fine tune it and bring it back and do a little bit better. So, but anyway, I'm excited about episode 9 because I got another professional on the line. And this is like, I mean, the whole series is dedicated to allowing Black women to share their birth stories freely, openly, and just create that space for us to have the conversation. So hopefully, like, after you all watch it, you're having the conversations with the people around you, you're asking questions to your providers, and to anybody that's like in your wellness network, right? So that's the whole goal. So having the professionals on is a big deal because now you get like an additional layer of information that you can just use for your own personal journey. So today I have my girl Yolande on the line. She is a psychiatric nurse practitioner, well, psychiatric mental health nurse practitioner, and she got a lot of credentials, y'all. I'm telling you, like, as I don't want to call myself a civilian, but as a person who is more or less a patient advocate, like, to see all of the credentials that these ladies have is like amazing, right? And some of the credentials is kind of like, did we know they exist? Like, what do they do specifically? And how can they help us on the journeys that we're on? And so I was so glad that I had Yolande because she is, over the past couple of episodes, we have been talking about like perinatal depression and postpartum depression, and like that seemed to be like a running theme. So to have her on here to like share her knowledge and just talk about what she does and how she just been carving her own lane in this space is, I'm telling y'all, like, things align the way that they supposed to, for real. So I'm happy. I'm gonna bring her up because as always, I want to let her introduce herself so that she can tell us everything that she does and all that she provides and what type of services she has. And then we'll like get right into it. So I'm gonna bring her up.
Hello.
Hey,
How are you?
I'm good. How you doing?
I am good. Thank you for having me.
No, you're welcome. You know what I forgot to talk about in the intro was how we had a conversation live one time. This was a few years back where we talked
Mhm.
about my birth experience, and you were there giving like information and just kind of raising awareness about all things medical when it pertained to maternal health. So this was like some time ago, and so you've been doing this work for quite a while. So I want to give you an opportunity to just tell everybody, like, who you are, like what you do, and run us down everything, because I want to touch on each thing and just kind of find out how we can utilize these type of practitioners in our day to day.
Absolutely. So, my love for maternal mental health started, I want to say maybe 16 years ago. I've always been a labor room nurse, straight out of nursing school. And then I shifted. I went to family nurse practitioner. I wanted a little bit more autonomy, but I still had a love for labor room and labor and delivery. And then I thought about psych. And then I went and got my psych NP because I said, you know what? I enjoy learning about the brain and how we function and all of those things. And then I said, how can I combine the two? Because I still had that love for labor and delivery and maternal health. And I also knew that when people think about labor and delivery or babies, you don't always think about moms being sad. You don't always think about, moms being overwhelmed. Everybody, you're supposed to be happy. This is a blessing. You should be happy you have this baby. And that's usually the theme. But when I put the degrees together and I got certified in perinatal mental health, it became even more apparent that number one, our community needs more education about what postpartum depression looks like, postpartum anxiety, and just moms being overwhelmed, especially as Black moms, where in our community, it's always been, you could do it, take it on. You don't want to seem vulnerable because then you're less than. If so-and-so could do it, then why can't you do it? They got 3 kids, you got 1. Why can't you handle all this? And that becomes very overwhelming. And then you start to have a lot of self-doubt. So the work that I do now is I care for moms. Either they can be pregnant, they can be postpartum, but I actually have clients that their kids are 6 and 7, but that mom role is still heavy. And I really go through talk therapy, teaching them coping mechanisms. As a psychiatric nurse practitioner, I can prescribe medication, but one thing I want to put out there is that, medication is not always our first line. Yeah. We do have people that need medication, and our community sometimes shies away from that because we do want a more holistic approach. But one thing that is very certain is that just like if you have high blood pressure or diabetes, you can do our first line, which is, activities, behavior management, all of those things. But sometimes you need a little bit of medication to help to balance. So I really try to make moms feel comfortable, even if we get to that point after they've seen a therapist. And now we're here where, you may need a little extra help. I allow them to feel comfortable about that. I educate them about the medication so that they don't feel like, they have to be embarrassed about having to take medication for depression or for anxiety, or that, they feel like their OCD is out of control. And it at that point it's kind of risk versus benefits. So if you are depressed, you're not going to be who you need to be for your child. So that's why all of those things need to be addressed up front. And just being honest with yourself. Sometimes we mask a lot of things because we want everybody to think everything is okay. Why I don't want to be the burden. I don't want to be the one that, wasn't able to do this and all that. But it really is an eye opener when you do talk to moms and they are vulnerable with you and they tell you, I really feel bad. Like I can't bond with my baby, or I didn't bond with my baby, or, it wasn't love at first sight. All of these rose-colored glasses that we have, and I see it a lot in the delivery room where you can already see a disconnect. And as nurses, our job was definitely to identify it, but then bring in maybe social work, find out if there are different family dynamics, something is happening, because you also don't want to send the baby home with a mom that doesn't feel good. So all of those make a difference.
Yes, that is good. Okay, so pause right there, because I know, first of all, this is Mental Health Awareness Month.
Yes.
And Preeclampsia Awareness Month. And today just happened to be World Preeclampsia Day. So before we get into all of the particulars of the medical field and your profession, first of all, tell us about your practice. So that's what I want to get you to talk about first. And then we're going to go to the personal stuff.
Okay. So I do telehealth. So I am remote, and I see patients who, again, they're either pregnant, they're postpartum, or they have delivered, and it's a woman-based service. And I really provide coping mechanisms. We do talk therapy. I kind of equip them with, this is your plate. Let's look at what's on your plate. And with moms, it's really about delegation. How much are, where are your barriers? Where are your boundaries? Have you created those? And what are you allowing yourself to delegate
Yeah.
to receive the help? We don't like to get help because, again, we got it. It's okay. I can take care of it, because our mom mantra is mom will figure it out. And most of
Mm-hmm.
the times we do. We got
Yeah.
it, but at some point you stop and you realize, wow, like I am the one that has to figure it out. And when
Mm-hmm.
you know that that is your role 24/7, it becomes a lot. So I
Mm-hmm.
help moms through that. I also, again, prescribe medication if I feel like it's needed after an assessment. And then we do follow-ups. And, medication is not something that moms need to be on forever. But just like we have cycles in life, this may be your cycle that you need that medication, that extra help, until you can balance things out.
Got you. Got you. So first, let's talk about, I want to segue into your personal experience, because I do want this. I want to try to tie in like your personal experience and then move into, you moving into the profession and now what you see as a professional versus your own personal experience. So, the first question I always ask anybody is like, what was your experience growing up and having discussions in your home or with your family members um, about motherhood and childbirth and pregnancy? Like, what was the discussion like within your family?
Well, my mom was a nurse, or she is a nurse. So medical was very fluid for us. It
Mhm.
wasn't something that was not talked about. There was always a lot of support, all hands on deck. Somebody is pregnant. We actually, when my aunts got pregnant, they would go to my grandmother's house, and that was the
Mm.
house where everybody would go. She was taken care of, so it was always a very supportive arena.
Got you. Oh, good stuff. So even when it pertained to like the experience of childbirth, like was that, have you ever seen like anyone in your family or immediate family like deal with perinatal depression or anxiety or postpartum? Like did you see that firsthand growing up or only like when you got in your profession?
I would say only when I got into my profession, or maybe it just wasn't as a parent, because again, everything, you have so much support, so it seems like everything is going well.
Mhm.
And at that time, it was, mom, you go sleep, I'll take care of the baby. So there
Mhm.
was a lot more hands on deck with that. So I didn't really see any type of mood or anxiety disorders while I was growing up with the pregnancy and
Mhm.
the maternal aspect growing up.
Got you. Got you. So seeing what you've seen as far as like the community type of atmosphere when it came to women giving birth and motherhood, what was your expectation like moving forward? Like what were your expectations for your pregnancy or for your childbirth personally? Like did you have any expectations? Did you think of how your particular experience was supposed to be?
I did. So the first pregnancy, I I was very much I was reading books. I was like, okay, let me prepare my bag at 36 weeks. I was on top of everything. And that honestly kind of allowed me to see that I do have a little bit of a compulsion. So, when you want to get things exactly right, this is how it's supposed to be, this is how it's going to go. Um, and so that was thrown off because I was very sick during my first pregnancy. I was admitted to
Mm.
the hospital. I was throwing up. I mean, everything that you think, okay, it's going to be this nice, pregnancy from what I read, nothing at all. So a lot of in the hospital admissions. I still remember vividly. There was one time where I want to say maybe 36 weeks, and my mom called and she said, yeah, is the baby moving around? And I'm thinking, man, I haven't felt him move around. I
Wow.
rushed to the hospital. Like I was in a complete panic. They had to do a spinal tap because at that point I was having a headache. It was just so much stuff. And I think that um, in that it was always heightened. So from that point on, it was then, I hope everything is okay. I hope everything is okay. And then that led to very much anxiety until I delivered.
Mm. Okay.
Yeah.
So you did, so would you say or would you call it perinatal anxiety that you experienced at that time?
Absolutely. With my first child, yes. With the second child, I was older, so I was a little bit more prepared. I wasn't as, when you don't know, you don't know. But when you do know, you have some type of expectation. But as they say, every pregnancy is different. I stand on that. So second pregnancy was not as sick, but it was more like, me being a lot more conscious of my weight, me being a lot more conscious of, how I look, what I'm eating. So very much on that. And with that pregnancy, after I delivered, which as we talk about preeclampsia, I went home. Well, let me go back. The first pregnancy, beautiful delivery, got home, could not breastfeed. He was 8 pounds, 10 ounces, and we latched, we tried to do all type of stuff, and it just wasn't happening. And I said, okay. From that point on, I think that I had a breastfeeding complex. So now my mind was focused on, when you have another child, you're going to breastfeed. It's going to be successful. At the second child, I tried to breastfeed to the point like it was ad nauseum. I had stopped eating because I was so focused on pumping and making sure the baby ate, and the baby wasn't getting enough. I had mastitis, so it gotten to the point, and again, I was at my mom's house because that was kind of the trend. Now go to your mom's house. So my mom, being a nurse, took my blood pressure, and she's like, your blood pressure is 176/90. And I remember the numbers because my blood pressure has never been that high. I'm a 120/70 girl. And she said, we need to call the doctor. I went back to the doctor, and at this time, so now I have 2 kids. And although I have an excellent support system, I'm thinking, what's going to happen with the other one? So your mind is racing. I ended up being readmitted to the hospital. And so when you are admitted back into the hospital after you've had a delivery, it's significantly different because you don't always have the baby with you. They had to go through different channels in the hospital to allow the baby to come back into the hospital again. So now I really can't breastfeed. So it was a mess. But the main thing was that we need to get this blood pressure under control. Yeah. And I understood that, but I didn't understand it because at that time I was a nurse, and I'm like, listen, and sometimes they say nurses are the worst patients. Yeah. Because I was like, no, I'm not taking that. I'm not taking that. I don't want that. Where's my baby? It was a lot. Yeah. And that didn't help with the blood pressure. So, it was, and, I have been blessed to have awesome providers that were very, very patient with me. And I think that that's one of the reasons why I wanted to do labor and delivery. My first nurse was very patient. I didn't know how to push. I was telling her I was pushing. I really wasn't pushing. She was like, okay, now, but so patient and compassionate. And I think that that's what you expect out of your labor room nurse, because you only get that experience one time for that one pregnancy. And that's what a lot of people, that's the hallmark, either they had a great nurse or they're going to say, that nurse really, she was rough. She didn't care. She wasn't compassionate. And that's kind of always how I've mimicked my practice. Like, I want the patient to know that I'm care. Even when we had fetal demises, like, especially moms are very vulnerable at that time. You have to be able to be compassionate and understanding of, sometimes they're going to have an attitude. Sometimes they're going to be upset. Moms are in pain when they're in labor. If you have a mom that comes in and doesn't necessarily want the epidural, but their pain management is not controlled, at that point is not the time to say, well, you should have took the epidural when I told you to take the epidural. So,
girl, don't do that.
So it's like, okay. And then the last pregnancy, I have to say, was the most calming. I think that by that time I had definitely started exercising, using yoga, like really, I got a perinatal massage. It was a lot more like, okay, I can do this. It's going to be okay. Still went in with the, okay, I'm going to breastfeed this baby. It didn't happen. He had jaundice, had to stay in the hospital, came home with the lights. But at that time, though, I had a lactation consultant. They came to the house. One thing I will tell moms, though, and I found out later on when I made the decision, okay, well, you know what? I'm really stressing myself out over trying to produce this milk. And it is counterproductive. Like, you're not gonna, it's not gonna work that way. But talking to one of my really good friends later on who had successfully breastfed, and I'm like, I want to be in that I breastfed for a year and 3 months crew, but it just didn't happen for me. But she did advise that, you can take a breastfeeding break and go back. For some reason, I don't think I ever got that education. I thought once you stop, that's it. You can't go back. So it is so great for moms to talk, especially about your struggles, especially about things that, you need help with, because There are other people that have done it and done it successfully. So don't take it as a, a barrier. Ask questions, be involved, because that's the only way that you're gonna have a success story, especially if it's something that bothers you.
Yeah. Oh my gosh. So I mean, you right. I guess everybody say that, like every pregnancy is different. Every childbirth experience is different. And
Mhm.
then I think from what I remember, the consensus of a lot of the ladies here who had multiple childbirths or multiple pregnancies, like every I guess as you have more experiences, sometimes it become a little easier. Like you know
Yeah.
what to expect, or you're
Mhm.
not as nervous, or now you know what to do. You're more
Right.
prepared, and so
Mhm.
that kind of helps, right? I would guess like
Absolutely.
that helps, right?
Yes. Yes.
And especially from an emotional and mental standpoint, like it
Mhm.
absolutely helps because now you're not as frantic, and you're more knowledgeable, right? So you know how to
Exactly.
advocate better and that type of thing. So
Mhm.
so yes, like 3 pregnancies, all different experiences.
Yes.
Um, were any of your pregnancies planned, and did you have like I know you say for the first one you kind of had like a plan, you knew to
Mhm.
prepare your bag and things of that nature. But did you have like a birthing plan, like a specific birthing plan, or a way that you wanted to deliver? Like, did you have any plan in place?
Actually, I didn't. And I think that that comes from my experience working in labor room, where I know that it is very subjective. Things do not always happen as planned. And
Mm-hmm.
as nurses, your mind is healthy mommy, healthy baby, safe delivery. That's like the
Mm-hmm.
goal. So I was okay with the vaccinations and bathing the baby. And, so some of the things that we put in the birthing plan, I was like, okay, you know what? I'm okay with all of these things.
Mm-hmm.
So that's why I didn't necessarily have a plan. When I went in, most of the times I was already in an active labor, so I knew that Pitocin would be started. So I think the knowledge from just being a nurse in labor room, I knew what the routine would be. I don't think that I was okay with if I had to have a vaginal delivery or a C-section. I know that some
Mm,
moms are very much like, I don't want a C-section, that I want vaginal. This is what it is.
yeah,
But I also understand that if that baby is at risk, we need to get the baby out. So
right.
so very open mind. And then I also let my husband know as well, communicating what, God forbid something happens to me, I can't make decisions. This is what I want.
Yeah.
I'm okay with this, and this. So I just need to be here. So
Mm.
yeah, make sure they wake me up. That's it. Uh, so yeah, no, but I go in, and then even with my patients that I have now, I always find out, especially if they're pregnant, what are your expectations? Because
Mhm.
that is where one of the greatest loss come from, because we have unmet expectations when we get
Mhm.
to labor room during our delivery. And it even goes down to like, who did you expect to be there? What did you expect the experience to be? For people that are a lot more calm and zen, they may just want their partner in there. But
Yeah.
when you have mom and mother-in-law and this one and that one, everybody wants to come in, you're already faced with okay, what decision do I make? Who do I let in? And then I don't want to seem like the bad guy and say, okay, well, I don't want you there. You can't come. So it honestly even starts before you get to the labor room. So
Yeah.
I always encourage moms, think about what your expectations are. Think about what you are going to be malleable about. What are you, are you okay with them saying, okay, now we have to add a little something to induce you? Or are you okay with them saying, okay, you know what? We have to take a different route here. All of
Mm.
these things so that you are not overwhelmed with the decisions that you have to make in the labor room.
Mhm. That's important because I guess when I think about like I didn't even think about a plan in that sense, even though, we all know things can go not as planned, they
Right,
can go
right,
anyway, right?
exactly. Yes.
But I guess initially my initial question was, did you have a plan? And so of course I'm thinking like a birthing plan as far as
Mhm,
like, where you want it to deliver, like if you wanted it to be in a
mhm,
hospital or a birthing center, or these
mhm,
types of things. But then when you get down to like literally like the life and death type of situations that we don't
mhm.
normally think about but are very much are very much
Absolutely.
possible,
They're real when
right?
you walk through the
Like,
door. Yeah.
yeah, those conversations are so necessary. And I don't
Mhm,
know that, many of us had those types of conversations with our support system. So that's an
mhm,
excellent thing that you're doing, especially when we're talking to um we're talking to pregnant women, or prior to pregnancy, we're talking
Mhm.
to women about like these are the types of plans you need to have in place. Like,
Right.
not forget about where you're gonna have a baby, because that's important too. But
Mhm.
if this happens, right, or should this
Mhm.
happen, what is the plan? What would you like to see happen? And
Right.
does your family or your support system know about that? You know what I
Absolutely.
mean?
Yes. Yeah. Would you be okay receiving blood if they have to do a
Mm-hmm.
hysterectomy? Or are you like, no, or are you like,
Yeah.
take it out? What? Yes. Yeah. But to your original question, I've been very comfortable in the hospital. So I never actually thought about having my child at, a birthing center or anything like that, because the hospital has always been kind of my second home. So I
Mhm.
was very comfortable there.
Got you.
Yeah.
Got you. So that's good. Now I want to kind of tap into, um, I guess more or less how you use your personal experiences to kind of transition into your profession. So, just knowing that you've had, like, for the most part, like fairly healthy pregnancies and childbirths, what was your experience like going into the field and then seeing for your own, for your own self, like other women having like difficulties or challenges with the pregnancy process or the childbirth process? Like, how did that shift your mentality around like how to prepare mothers for this time?
I think my experience complemented the work that I'm doing now, which is why I think that I'm one of the more knowledgeable providers, because I have been in the labor room. So I can actually answer questions sometimes if mom says, well, my physician said that they wanted to do this and I really didn't understand it. They didn't really explain it. I can use my knowledge and I can kind of try to clarify. Now, sometimes it helps, sometimes it doesn't, because you hold on to some things, but it really complements the work that I'm doing now. I understand birth trauma. I understand unmet expectations. I can actually be a little bit more mindful as well, just with moms who say, you know what, I really am, motherhood isn't what I thought it was going to be.
Mm,
I feel like I'm attached to a ball and chain. And
mm,
I've heard moms say that. And it's not for me to say, well, how could you say that? You know how many people out there trying to have kids? That's not my role.
right.
What I can do is, allow them to kind of step back, because motherhood is huge. It's huge. And sometimes, again, going back to those expectations of what you thought it was going to be versus what it actually aligned to be can be so incongruent that it
Hmm.
throws you off. And you're like, I didn't sign up for this.
Yeah.
So a big portion of my role is really helping them to understand and then hopefully really enjoy motherhood, because that's the point. We want to enjoy it. We want to embrace it. And it's not easy for a lot of people to do that. But
Mhm.
when they come and see me, I try to help them through that process. So yes, even with, having high blood pressure, I understand. And a lot of moms will say, every time I go to the doctor's office, my blood pressure is high, but when I come home, it's not high, So,
Mhm.
and I said, okay, well, are you taking the blood pressure cuff to the doctor's office? So let's make sure that, those things are aligned. And that's where my family nurse practitioner role comes in. So I can really kind of give them a full spectrum care.
So that really is like a holistic type of, I mean, you do wear like a holistic hat, because if we're touching on not only like the physical body, but the mental and emotional, and maybe even I would probably guess like even like a spiritual component as well.
Mhm.
Um, that's like total body, like a holistic approach. So when we think about like your credentials as a mental health nurse practitioner, I heard you say like you do talk therapy. So does that mean that you also kind of double as a therapist as well as a nurse,
Um,
or?
well, our scope is not therapy, because therapists use different types of techniques. So, CBT and different
Mhm.
types of modalities. So when I have clients, talk therapy is really something like, okay, you give me a scenario and we're looking at it. I'm giving you a different point of view. I'm using my not just professional hat, but to also kind of let you know, okay, so let's look at this in a different spectrum. So I try to reframe, which is also a term that
Mhm.
therapists use, but giving a different perspective.
Mhm.
And, so that we can do without saying, okay, you know what, I think you need to transition right to medication. But
Gotcha.
again, some people really just need a different point of view, a different perspective, but from a professional that is actually looking at the signs and symptoms that you're presenting with, and then saying, okay, you know what, this is the diagnosis, and either talk therapy, which is what I can do will help, or I would actually also refer you to a therapist. So the therapies, they complement each other. I see a
Mhm.
lot of people that are very they're successful with just therapy alone, and again, some people need therapy and the medication management. So we're kind of like a tag team.
Yeah.
Hmm.
Got you. Okay, that's helpful because um thinking now, like, obviously therapy is an asset, right? In these
Yeah.
situations where you see like there is some type of emotional imbalance or some type of imbalance, right?
Yeah.
Um Tell me a little bit about like the perinatal, what would we consider like a perinatal? Because then I also want to talk about what is postpartum. So talk to
Mhm.
me a little bit about perinatal and what time frame is that? Is that the entire pregnancy or just a portion of it? Or tell us a little bit more about that.
So perinatal is really like an umbrella. So perinatal is while you're pregnant. Antepartum, that so all of those can be used interchangeably, really. So perinatal mental health while you're pregnant, and then postpartum, of course, after you've delivered. What we see during the perinatal phase is really a lot of anxiety because especially for first time moms, something new. We're trying to figure this out. Even if you've had a mom that has had a loss. So a lot of people do not think about the fact that they can be anxious as well. You automatically think they should be happy. They're pregnant again, but what I've learned is that every single appointment, anxiety increases, especially
Mhm.
if it's around the time where the last loss was, or there's going to be several different triggers right up until you deliver. And then even when you deliver this healthy baby, it's still what's I hope this baby's going to be fine. I hope this baby's going to. So that's a constant thing. And then we have to think about the unwanted pregnancies. So moms who are experiencing depression because their support system is not together. This pregnancy is not what I thought it would look like. Broken situations where, oh, okay, so you're pregnant and now you're like, okay, so I'm by myself. What am I going to do? So all of those things can kind of happen during the pregnancy right up until you deliver.
Mhm.
And then after the pregnancy, so postpartum, so there's what we call baby blues, which is the first 2 initial weeks after you deliver. So your hormones are really trying to get back into balance. After that 2 weeks, if we're going on week 3 and week 4, and this is especially for families and support systems, if you see that mom is really just, sleeping all day or not really eating. So this is where you see significant changes in eating patterns, sleeping patterns, little motivation. Now we already know that moms are going to be tired because the baby's waking up, the baby's trying to regulate their sleep cycle. But if you have a mom that's just like, you know what, I'm just going to let the baby cry. I can't do it.
Mhm.
So these are red flags. And what bothers me sometimes is when we do hear these unfortunate scenarios on the news about, mom hurt the baby or hurt her children, when they interview people that are in their support system, they say, I knew something was wrong. I knew something
Mhm.
was wrong. But
Mhm.
I think what happens is that we don't know how to address it, because
Yeah.
you can't, moms are not going to say, yes, I'm depressed. They're going to use words like, I'm very overwhelmed. Sometimes I just feel hopeless. I just can't do this anymore. And we need to take those words as heavy as they are with the weight that they carry.
Yeah.
So, if you say, okay, if you have a mom or a friend that is saying, you know what, I just can't today. Is there anything I can do to help? So us being able to offer help that we can carry through is going to be the biggest assistance. But yeah, moms are not going to sit and say they're depressed. Moms are going to miss their postpartum appointments. And one of the reasons why I've also segued into really reaching out to pediatricians is because we find that moms are going to take the baby to the doctor. They're going to take them for the checkups. They're going to do all of that, but they're going to neglect themselves. Moms
Mm.
are going to feed the baby. They're not going to feed themselves. So when you see that, especially when there are other children in the house, it when something's going on with mom, the whole house is affected.
Mhm. Yeah.
So we have to keep that in mind. And as much as we want to try to balance things out, it just isn't.
Yeah.
So what I encourage moms to do is prioritize. And sometimes, well, most of the times we prioritize ourselves last. So we're
Mhm.
never a priority. But we got to shift it. Just like they rotate that stuff in the supermarket. One day you have to be the priority. And that sometimes means saying, you know what, I can't do this, or I'm not available, or asking for help. So
Yeah.
that's definitely what I push, because postpartum depression, people think, okay, it lasts for a couple months. People can be functionally depressed, but
Mhm.
if you don't ask the right questions, if you don't pick up on it, they are like, oh, I'm scot-free because I don't have to address how I'm really feeling.
Yeah.
And if we see it, if you see it, call it. you know
Yeah.
I noticed that recently you haven't been wanting to come out, or you've always, I'm inviting you out or want to come over or would like to bring you some dinner, and you're always declining, like you're isolating. And that's
Mm,
what you'll see a lot of as well, moms isolating, because the help can also be a hindrance. So if
yeah.
you're getting all this help, you really don't need to deal with the baby, you really don't need to deal with your feelings, so you're allowed to just be over here in isolation. And
Mm,
that's a huge red flag as well.
got you. Wow. So even, and I think that that's an important conversation again too, because like you say, oftentimes, and I do want to touch on how sometimes it'll kind of be shrugged off as what I've seen, or like or what I've heard is that oftentimes like the medical professionals might say, oh, well, this is like normal pregnancy something, or
Mhm.
like this is, women usually have mood swings or mood imbalances when they're pregnant. And so sometimes I think even us as moms or as a community, like we'll say like, oh, okay, she just pregnant,
Mhm.
or like, oh, she good, like, that whole thing where every woman is their emotions out of control, their hormones out of control when they
Right.
pregnant, right?
Mhm.
So I'm glad you brought up a lot of those signs and symptoms, and they relatable, because that is true. Like just something as simple as just always declining an invitation, or
Yeah.
staying locked up in the room, or
Mhm.
like those things are like relatable scenarios where maybe we've all seen that happen before, but just thought, okay, well, maybe she just tired, or maybe
Mhm.
she just, so those things are important to look for. What about like even during pregnancy? So like, could you like say like some of the symptoms some women may experience if they're dealing with like anxiety, so to speak? So I know that's a little different from depression. So if a woman is experiencing anxiety, like what might that look like?
Anxiety, you're gonna want to stay in the house. You're not gonna want to do anything because you don't want to mess up this pregnancy. A lot
Mhm.
of pregnancy anxiety is very much based off of fear. So anxiety, just baseline, is our minds going 50 miles an hour faster than what is really happening. So unrealistic sometimes. You know, okay, if I get in the car, then I go out to the corner, somebody may hit me. So let me just stay inside. So
Mm,
everything is going to be and anxiety most of the time has a negative connotation with it. We don't have anxiety because we're doing something good or we think something
mhm.
happen, is going to happen to us. But so my moms with anxiety, definitely avoidance. They want to avoid everything. They are very particular and meticulous about what they eat because they don't want to gain too much weight. They are going to
Mm,
be at every appointment very early. They want everything, spelled out because they don't want to make a mistake. And I
got you.
think with those moms, it's really reassurance that there is no perfect mom, and you're allowed to make a mistake. I mean, obviously not one that's going to deal with the safety or the health of the baby, but
Right.
with regards to the anxiety, it kind of stirs you up even more. And
Mm,
yeah, so it keeps you on 10 all the time. And I say, it's tiring. So
I can
those
imagine.
moms often, experience insomnia before the baby is even here because they're thinking. And some of the thoughts, when we really, I say, you know what, write down all of your thoughts and look at them and see, are some of them realistic? Are some of them, are a little far-fetched? Not validating it for them, but also understanding that, is this something that can truly happen? Because if it's
Mhm.
not, I don't want you to focus on this. Let's look at some of the other things, look at them, see why there's such a fear, or why you're so anxious about them, and then let's see if they're triggers. A lot of women have anxiety from a previous pregnancy. If somebody else told them about a pregnancy, if something else happened to somebody else, it's always, well, that could happen to me. That could happen to me, right? So it's like, which is why in a lot of the pregnancy support groups, there's a stipulation like, no, they don't want, not necessarily bad birth stories, but we don't want to scare the other
Right.
moms that are having this experience,
Right.
because we want everyone to go in with a fresh mind. Okay, you know what? This is a clear slate. Everybody's birth experience is different. So
Right.
that's why it's helpful again to share education. But
Mhm.
if we're going into, my doctor left me in there and I bled out and then they had to transfuse me. Yeah, all of that, exactly how your eyes are. That's how my moms are. They're like, Oh no. Oh, don't worry about it. Forget it. I'm never doing it. So, and so we have to be mindful about that too, because that feeds into the anxiety, which definitely can segue to OCD. So then your moms get very obsessive and compulsive. Um, Bringing it back to what I was talking about with regards to breastfeeding, a lot of women, um, you know, when you have a baby, it's okay, was it a vaginal birth or a C-section? If you had a C-section, everybody's like, oh, they had to cut you. Oh, and
Yeah.
sometimes it makes it seem like, well, what, dang, but I still had this baby,
Yeah.
but so, and I've had women that tell me, please don't tell my family I've had a C-section. Just tell them I had a vaginal delivery. You don't realize how much, again, that goes to expectations, how much it affects people. Some of the things that we
Mm-hmm.
ask them, especially about their birth experience. Did you breastfeed or bottle feed? And it's like, oh, I had to bottle feed. Well, why didn't you breastfeed? How come you didn't do that?
Mm-hmm.
And that's what we do.
Oh, that is so common.
Yes,
Just the
yes,
conversation around your experience that's
yes,
so common. And
yes.
I know people don't mean no harm. You know what
Right.
I'm saying? I
Exactly.
mean, maybe some people
Exactly.
do, but I
Right.
try to think in the mind frame like people don't mean no harm. They just, guess trying to get an understanding, but
Hmm.
how it might come off to a new mom is like, well, damn.
Right, like you're
What you
less
trying to
than.
say,
Oh,
you know?
you didn't do the real thing. Like, yes,
Yeah.
exactly. Yeah.
Mm-hmm.
And it already minimizes your experience for you. So
Mm-hmm.
then you go into the next pregnancy, like, oh, I'm gonna be able to tell them I had this vaginal delivery. I'm
Yeah.
doing it. And women
Mm-hmm.
come into the labor room like, this is what I'm doing. Because last time I had to have a C-section. So now I need to have a VBAC to, I guess, kind of prove to myself that I can do it.
Yeah.
And
Yeah.
so, yes, anxiety is very, very high. And anxiety and depression are more the prominent ones that we see during the perinatal time and even postpartum. Now, you have women that have schizophrenia, bipolar disorder, and those moms are still getting pregnant, and they can, as long as they stay on their medication. Now, those are moms that I definitely advocate that they stay on their medication. Sometimes we know that moms will say, you know what, I don't feel like being on the medication anymore. I don't want it to hurt my baby, so I'm going to get off of it. So
Mm-hmm.
our job is to let them know and educate them that no, you need this medication because that's going to be the best way for you to protect your baby. So
Dang. Like I've so when we're dealing with a psychiatric mental health nurse practitioner, is this something like, let's say for instance, what's the question I want to ask? Is this a specialty where maybe your primary or your OB has to refer you for this service, or is it more like preventative in nature?
well, some OBs are very comfortable prescribing psychiatric medication, especially for depression, anxiety. They're under the same category as far as medication management. And that's fine. Otherwise, if you, for example, if you just seek out to have psychiatric services, you can see a psychiatric nurse practitioner. So, and your primary too, it really depends on their comfort level. You have some OBs that are like, you know what, I don't want to deal with psych. If you have a mental health provider, go see them, and then we do collaborative care. So I'm able to share notes. We have the patient sign off. So it's more, continuity of care. But
Mm-hmm.
absolutely, yeah. So it really depends on how comfortable your OB is and your primary care. Now, usually with depression and anxiety, OBs and primary cares are very comfortable. With the other mood and anxiety disorders, they are probably like, you know what, go ahead and see someone that's specialized, very similar to if we, needed to see a cardiologist or a
Mm-hmm.
hematologist. Your primary care could work with that, but having someone in a specialty, this is what they went to school for. They've honed in on this practice.
Right. Got you. So now, okay, going back to like the perinatal care, um, when you start to see like, okay, these symptoms are a little bit like persistent
Mhm.
and maybe this does need medication, like how do you gauge or sorry, there's Amazon in my note.
Okay.
How do you gauge, I mean, I guess the balance between, and I know as a professional, like what medications are safe for the baby, what medications
Mhm.
are safe for the mom. Like, how do we gauge that? Because I know you mentioned earlier about how like a lot of people want like this holistic thing, so they don't
Mhm.
want to take medications, and that's a common thing, even if people not pregnant in our community,
True.
right? Like it's just this stigma on taking
Mhm.
medication, but
Yes.
when we're talking about like making sure that the mom and the baby is safe, right?
Mhm.
Like how do you gauge like, okay, medication, we can give this mom medication, or this won't affect the pregnancy at all? Like, are there like pregnancy safe medications?
No. So the first thing that we'll do is so the Edinburgh postnatal depression scale, the screening.
Okay.
So there's some screening tools, and that's usually what you give to kind of gauge, because that puts you in the parameter. Okay, if this mom needs medication, needs therapy, is suicidal, and we need to get someone there right now. So there are certain questions that are tailored for that.
Right.
The medications that we use in perinatal mental health are the same as we use in regular depressed patients, I guess you would say. However, we do look at the dosage. These medications are evidence-based. They're tried and true. There is no medication on the market that they're going to say is 100% safe with no risk factors.
Right.
But what we do know is that there's more of a risk if a depressed mom does not take the medication, if an anxious mom does not take the medication. So with all of the meds, even with primary care meds, you're going to look at risk versus benefits. So it is going to be more beneficial for you to be put on this medication than to not be. Even our moms that are very, very, very anxious and they have to be on benzodiazepines, we know that that is going to decrease the baby's heart rate, decrease mom's heart rate sometimes. So they stop that at a certain, before you actually deliver, then they would taper that off. So that's why it's so important to have everyone on the same page, you know, your OB, your delivering provider, whether it's a midwife, whoever, so that we all understand what's going on. Now, of course, we're not going to put, narcotics are not going to be the first line. We're going to try all of the other anti-anxiety medications before we, you know, put you on this. But we can't have a mom that's having constant panic attacks, because at that point you do feel like you're having a heart attack. You feel like you're going to die. And if you are doing that and you have all this cortisone rolling, it's not good for your baby. It's not good for your pregnancy. So when we explain it like that, and of course, again, trying other methods first, but if medication management is needed, the training that I have, which is the perinatal mental health certification, we go through all of the medications. We look at if they're, you know, what crosses the placenta, what is good with breastfeeding, because that is, of course, what moms are going to want to know. So, and the main point is that we want moms to be compliant. We want them to take the medication. So the more information and education you can give them to allow them to feel comfortable, the better.
Right. Got you. Got you. Well, that's good to know. Cause I mean, and then I guess I'm just looking to, I guess, wrap my mind around, like, say, for instance, there is a mom who had already been diagnosed with maybe some type of mood disorder and they've already been taking medication. So is that taken into account once they find out that they're pregnant and they're going through the whole pregnancy process? Are meds having to be tapered based on is it by, I mean, checking like blood levels, or it's just behavior based, or like, how does that work?
Well, if a mom already is on medication, we try to keep them on that medication if it's on our list of medications that are okay with this pregnancy. Otherwise, we would try a different class of medication, still on the same lines. And if we need to taper it down or go to a lower dose, then we would do that. But everything is on an individual basis. With our psychiatric meds, it's not necessarily like your lipids or cholesterol where you check, you know, blood work. But for example, if a mom is on Zoloft for depression, and that has been working well. And that's the main question. Are you taking the medication? Is it working for you? Because we know that, again, during pregnancy, hormones are a little unaligned sometimes. So we want to make sure that what you're on was working in the first place. So this is our baseline. And then we would continue to watch you with that. We wouldn't change anything. Gotcha. So a lot of times, you know, you want to go in and change up a bunch of stuff. We want to keep you on that medication. Again, if it's on that list of approved medications that we know have been evidence-based, tried and true, but still helping with the same diagnosis.
Gotcha.
So yeah, they're definitely a reevaluation. And then again, even when you get closer to your delivery time, are we still okay with the same medication? Again, we want to communicate that to wherever mom is delivering, because you don't want to say, okay, well, I'm delivering now, so now I'm going to stop the medication.
Right.
We can't do that, because we've been doing so well, and we want you to be stable once you take this baby home, because we know that that's another hormonal shift that is going to happen.
Got you. Got you. So I know you have the specialty in perinatal mental health, but do you see moms after birth, like for the postpartum? Okay.
I do. And it's great when I can have a mom who starts out while she's pregnant and then she segues over, just because of the continuity. And, you know, now I get to breathe with her and say, you know, we did it. we did it. We got you through this pregnancy, and you have this beautiful baby, and the baby is healthy. And so you can slowly see the anxiety decrease.
Yeah,
So yeah.
absolutely. Okay. So this is like so informational because I think the most important thing that I want like women or families or the community to know is like, there are all of these options that's available for us nowadays. You know what I mean? Like I remember when I had delivered or when I went through my childbirth experience, and they offered me psychiatric care, and I was just like, I'm good. you know
Yes,
but
yes.
I feel like it wasn't, and maybe it wasn't the responsibility of the professionals, but I felt like maybe because of the severity of things, or is that
Mhm.
something that professionals can gauge, like because of the severity you need to go anyway. But I know that it can't be forced,
Right.
but just given just given certain situations and circumstances, is
Mhm.
this like the recommendation, or is this something that is actually, I guess, prescribed? Have you ever had a patient where they might say they okay,
Mhm.
but do you just say, I'm gonna give you a referral anyway? Or
Mhm.
or just recommend, I strongly encourage you to just go ahead and do this, even if they say they okay. Because now looking back on my own experience, they asked me and I was like, no, and they was like, okay,
Yep.
well, you got your family here,
Right,
so
right,
I think you all
right,
right, you good. But looking back, it was like, I said I was okay, but I wasn't.
right.
you know
Mhm.
um but it was just kind of like just left at that. So do you find that you have patients where you've seen certain signs and symptoms, but they tell you they okay, they'll decline the service, but you have to kind of just, I guess, let them know, like, I'm gonna give you a referral and I strongly recommend that you go.
Right. Well, by the time they get to me, when they actually request a consult, they've already either been told by their therapist that they may need medication management, or they are already trying to get in front of it. So I have moms who are pregnant and saying, you
Oh,
know
that's
what? I
good.
don't know if I'm at risk for postpartum depression, but I don't want it. So let me have a conversation with you.
Hmm.
But otherwise, the hospital systems, when I was at the bedside, there is, when they go through all those assessment questions, especially on the mother baby portion, there is a part of the depression screening that's in there. So if
Hmm.
you score a certain amount, they will then trigger something to the social worker to come in and talk to you. Now,
Hmm.
like you said, most moms are like, no, I'm good, I'm fine, because at that time, everybody's there. Everything is
Yeah.
peachy, you ain't had to change a diaper yet.
Hmm.
So, but now, when you go home and you start sitting and reflecting, and it's like, okay, this is for real.
Yeah.
I think that a great intervention would be that when that follow-up call comes. And most of the hospitals do hey, this is your 2-week postpartum phone call. Is everything still okay? How are you doing? And maybe do that screen again.
Hmm.
I think that would be a great idea, because then you really have been able to see what life is going to look like right now.
Hmm.
So I think that would make a big, big difference. But otherwise,
Absolutely.
mom, when you see it, and I guess it goes back to us kind of calling what we see.
Yeah.
I've noticed you've been a little distant lately, and I think that there's something wrong. Even in the professional realm, sometimes people don't like somebody to say, I think you need to go to therapy.
Yeah.
Therapy has not been it's getting less taboo because everyone is using the word now. But
Yeah.
previous to this, if somebody told you to go to therapy, they automatically say, oh, you think I'm crazy?
Hmm. Hmm.
Instead of, okay, there's just some things maybe you need to talk through with somebody who's a professional who may be able to organize each of these thoughts for you, or really kind of dig in and figure out are there low hanging fruit that you can maybe address without
Right.
going crazy. So
Hmm.
yeah, it definitely makes a
Absolutely.
difference.
That's good. Thank you, Daniela. She's saying thank you for advocacy. But I want to, as we start to kind of wrap, I want to ask about how do you provide services to families? Because I know you are a family nurse practitioner too. But do you provide these types of services for family members? I know you mentioned support groups earlier. Do you offer support groups? What type of services would you say? Is it just individual or groups or
It's
families?
right now it's just individual. I would love to do some support groups in the future because I think they are helpful. I think that, and it would probably be over a telehealth or a Zoom platform, just because, mom's able to get out. One of the big barriers to even therapy is childcare. So
Mm-hmm.
COVID, wasn't great, but it allowed us to really utilize technology. So moms can make it to therapy and things of that sort and have their appointments and follow-ups. So the family nurse practitioner portion is more medical, whereas the psychiatric is more mental health. So yes, but at this time I only do individual.
Got you. Got you. Okay. So if you knew then what you know now about your own childbirth experience, would you do anything differently? Is there anything that you can think of that you might have changed, or would you say like everything was pretty good?
No, I honestly would tell myself to not be so hard on myself and
Mm,
have all of these expectations as far as the breastfeeding and what you wanted it to look like and why, and I think that I really ran myself into the ground with that. And I think that looking back, it was like it was okay. It was okay. I mean, and the kids are fine. They survived. They ate. It was formula, but the things that we put such an emphasis on, and we are our worst critics sometimes, and
yeah.
it really, like, it truly bothered me. Like, so I think that I would have told myself that it's okay and understood that sooner than later, because I think that I would
Mm,
have enjoyed just the process those first couple weeks without being so fixated on one thing. Um, but yeah, but otherwise I wouldn't change anything else.
yeah, absolutely. Um, and then last question is if you well, what is one piece of advice you would give a Black mama that's embarking on a pregnancy journey, a family planning journey? Like, what is one piece of advice you would give?
I would tell them to do your own research.
Mm-hmm.
It is very, very easy to have outside influences, and that can kind of skew what you really want. And I
Yeah.
think that right now, everything is not necessarily supposed to be a cookie cutter type of experience. Develop your own experience, figure out what you want to do. And then if you have questions, do some research, ask about it. But get your baseline plan first so that you're not discouraged or, kind of deflated by what other people are telling you, other influences, all of that.
Yes, that's good for real. Yeah, and I think that too, like that's kind of been a running theme too over the course of all of the episodes was like,
Mhm.
do your own research, ask questions, advocate
Mhm.
for yourself. Like all of these things are important in the grand scheme of things. And so the more knowledge we have, the more information we have, the better choices and decisions we can make.
Mhm.
And, it could essentially like save our lives. You know what I mean? So,
Exactly. And I think when we hear the word advocate, sometimes people think of it as like you're being aggressive or overly assertive. Advocating can absolutely mean saying, okay, so are you able to explain this a little bit better to me so I can understand it? And that's, with any provider, because you do want to understand the care that you're getting. You do have a right to a second opinion, and you don't necessarily have to agree with everything that the physician or whoever the provider is, they're saying. But what we do want to understand too is that if you've gone to three different providers and they've told you the same thing, there's a consensus. So they step back and look at the information that you're getting and then work with it from there. But
right.
definitely, I appreciate moms who advocate, who ask questions. I don't get offended. If you have a provider that does get offended when you ask them questions or
Mm.
ask them to clarify something, then that might not be the right fit for you. You know,
Oh,
because you should be allowed to ask questions so that you can feel comfortable with the care that you're getting.
yes, that is absolute. Dang, I wanted one last question because I just thought of this just now. If you have a mom, let's say for instance, you have a mom who never been on meds, never been diagnosed with anything, but during the term of their pregnancy or postpartum period, they start to have a lot of these symptoms, right?
Mhm.
Would you say, and I know it's case by case basis, but would you say that it is a practice or a common practice or not that they can be prescribed medication for a short term or like for um as a way to kind of help them through like I guess that period of time? Because I know there are like situational things, right?
Correct.
So
Yes.
do you see that happen a lot? Because, and I'm asking this for my own personal, because I had this experience before. Like, I never been, obviously, like, on paper diagnosed with any mental health disorder or
Mhm.
mood disorder or anything, but there was situational times where I thought, like, okay, if I just had something to help me kind of like calm my nerves, or
Mhm.
that type of thing. And I remember a provider telling me, I'm gonna tell this story one day on my own, but I just remember, long story short, a provider telling me, like, oh, well, you don't have a history, so we can't get that to you.
Oh,
Right. And not that I asked for a specific med. I was just
right,
like, I
right,
don't even know what you would give me, but I need something,
right.
like,
Something.
you know
Yes.
what I mean? And
Mhm.
they straight up denied me. And it was a horrible experience, because I was just like, it was just weird. But
Mhm.
do you see that happen often, where people who may not have a history,
Mhm.
or, they may just be facing some type of situational thing? You get what I'm saying?
Yeah, yeah, actually, yeah, no, and it absolutely happens, and at that point, it would be more, for medical terms, an adjustment disorder. So,
Hmm.
if we look at some of the things that transpire, and even outside of the postpartum period, just if you've had a huge life adjustment,
Hmm.
all of those things, yes, and we can prescribe medications for short periods of time, and you would follow up. Let's do 2 weeks. Normally, it takes about 4 weeks for the medication to do its thing, but
Right.
so yes, you can prescribe medication, and I have, for short periods of time, and then when mom says, you know what, I'm feeling great, we'll taper it down, and then when they're off of it,
Yeah.
we'll
Hmm.
continue to monitor, and then if they're good, then they're good. And I think that doing that is better than saying, okay, no, you don't need it, or telling them, okay, this is something they need to be on forever, because of the fact that that is something that's going to discourage them from even taking it in
Hmm.
the first place. And if you really need the medication, take the medication.
Yeah.
you know
I got
um,
you.
Depression and anxiety is not, unless they're chronic, is not something like, for example, blood pressure. So you can be on blood pressure medication. Everybody kind of works to try to get off of blood pressure medication, but you are still a hypertensive at the,
Hmm.
underlying. So with depression and anxiety, you may, and that's why they ask you have a history of it. But if you don't have a history of it, doesn't mean that you can't get it. And it
Right.
doesn't mean that pregnancy can't exacerbate it, or different. A lot of and this is off topic, but even with schizophrenics, a lot of them are diagnosed in their late teens when we're going to college, because that's a huge life change. It's a stressor.
Hmm.
So you see that, at that point, it's like, okay, wow, there's so much going on, and it's a trigger.
Hmm.
So we have to, and that's why, the diagnosis is so important. The treatment is so important, and you just getting help, again, acknowledging it, is very important.
Hmm. Do you see, like, a high number of situations where you see mom with some type of perinatal mental health issue? Like, are you seeing that often or a lot in your field
Well, right
amongst
now,
black moms?
no. I mean, and I think that it's severely underdiagnosed, though. I
Hmm.
think that, again, we say, okay, well, it's only been 2 weeks, come back in a month. Mom's not coming back in a month. She's just dealing with it now.
Yeah.
So it is very much underdiagnosed. I mean, and then you have to think about, like, the OB offices have a lot. The the pediatricians have a lot. So they're not necessarily doing all these screenings, but you
Hmm.
do have some very astute OBs and physicians and pediatricians that are saying, you know what, something's off.
Yeah.
The last time you came, and then they will give them a referral, which I think is amazing. So, but again, it's all eyes on deck. And that's how we have to be, because otherwise you slip through the cracks.
Got you. Got you.
Mhm.
This was even for me, this was informative, because, it's an interest, right? And it's also, like you said, it's not only underdiagnosed, but it's not talked about,
Correct.
for all of the common and
Mhm.
obvious reasons, right?
Right.
So just having that conversation and having, like, women know, like, this exists, this service is available. So
Mhm.
even if you don't have your provider to refer you out, like, that you can seek it out because it's
Correct.
there.
Yes.
So all right. So I want you to just tell everybody where they can find you. What's the name of your practice? If you're accepting new patients, and yeah, like, I want them to be able to know where you are so that they can reach out if they need you.
Absolutely. So it's Brighter Days Maternal Wellness Service, and our website is www.brighterdaysformom.com. And we are remote. I'm telehealth. So you can go on the website, you can request a consult, and I will get back to you. I usually do at least 24 to 48 hours. And if not me, get the help somewhere.
Yes.
I'm definitely an advocate for that as far as education as well. Just sharing the knowledge, getting your support systems together. If you feel like your support system is lacking, reach out to a support group. And I try to share a lot of that stuff on my page as well.
Got you. Got you. All right. So y'all follow Yolande. She is like an expert in this field because I even today I just learned a lot myself. So this was very much necessary and informational. I thank you for agreeing to come on and just and talk to
Absolutely.
us and just give us a little bit more knowledge than we had before. And yeah, so I'm gonna tag all of your pages so people know where to find you. They can, it's a easy find. But yes, I will definitely look forward to talking to you soon.
Yes.
And thank you so much again.
Thank you very much for having me.
You're welcome. Later.
Righty. Bye bye.